Back pain not only warns of a spinal problem, they are also symptoms of abdominal diseases such as appendicitis, kidney stones, fibroids, pancreatitis. Most back pain is caused by damage to one or more structural components of the lumbar spine and coccyx. Among them, the most common is degenerative disc, herniated disc, vertebral slide, pelvic arthritis, spine tumors, osteoporosis. However, damage to organs in the abdomen or urine the frame also causes back pain. If we do not pay attention and comprehensively examine, the risk of omitting these injuries can occur. Below is the sharing of Dr. Tran Quoc Khan, Department of Spine Surgery, Viet Duc Friendship Hospital, Hanoi, about the injuries in the abdomen that can cause back pain. Kidney stones, ureteral stones. The kidney is a pea-shaped organ located on either side of the spine. Usually, each person has 2 kidneys on either side. Some people have only 1 kidney, others have an extra kidney. When urine has a high concentration of minerals and salts, stones of different sizes can form in the kidneys. Pebbles do not always cause pain. However, as they grow, they clog or move in the kidneys, passing through the ureter, causing significant back pain. Characteristics of a kidney ureter stone pain include pain on one side of the spine, pain associated with nausea, sweating, rolling or dull ache, which may be accompanied by hematuria. An ultrasound of the urinary system with regular X-rays of the urinary system will give us a conclusion. In a more difficult case, the doctor will scan a CT scan, abdominal CT, the urinary system. Related diseases of back pain. Related diseases of back pain. Kidney infections, urinary system. The kidneys are also susceptible to viral and bacterial infections. These infections are usually caused by bacteria entering the urethra from the intestines and upstream to the bladder kidney, or from blocked urine flow due to kidney stones, tumors and other urinary tract problems. Kidney infections can cause inflammation and pain in the backs, depending on which kidney is infected. Other symptoms include fever, body infection, cloudiness, and urination. Ultrasound with blood test, urine test give us a definite diagnosis. Retroperitoneal tumor. These are abnormal tumors that appear between the abdominal cavity and the back of the spine after the peritoneal. Therefore, these lesions often cause back pain earlier or are associated with abdominal pain. Postperitoneal tumors can originate in the fetus, endocrine neuromas, lymphoma, germ cell tumors, or metastatic cancerous masses. In addition to the symptoms of back pain, depending on the location and nature of the tumor, the patient will have the corresponding accompanying symptoms. In order to diagnose the disease, you will have an ultrasound combined with abdominal computer tomography and a biopsy. Fibroids. Uterine fibroids are solid and often benign tumors that develop on the wall of the uterus. The cause of uterine fibroids is unknown, however, they are controlled by hormones, especially estrogen and progesterone. Uterine fibroids can vary in size and symptoms. Some patients with fibroids do not experience any symptoms, or may experience lower back pain, irregular periods, menorrhagia, frequent urination. Abdominal ultrasound usually assesses this damage. Endometriosis. Endometriosis is another gynecological condition that can lead to symptoms of low back pain. The disease occurs when endometrial, uterine tissue grows outside the uterus, most commonly in the ovaries and fallopian tubes. Endometriosis can lead to low back pain, infrequent but intense and strenuous. The cause of endometriosis is still being studied. Ultrasound and gynecological examinations often diagnose the disease. Ulcerative colitis. This is a chronic lesion that leads to inflammation and ulcers mainly in the large intestine, also known as the colon. Symptoms of ulcerative colitis include back pain and abdominal pain, which can be felt on one or both sides of the body, accompanied by diarrhea, rectal pain and weight loss. Researchers do not know the exact cause of ulcerative colitis, but certain genetic and environmental factors may play a part. You should colonoscopy entire periodic to detect early and treat this disease. Appendicitis. Another common inflammation that can cause low back pain is appendicitis. The appendix is located on the lower right side of the abdomen. Pain from appendicitis is usually felt on the right side of the abdomen and the lower back. Symptoms of appendicitis include fever, body infection, bad breath, pressure on the right pelvic area. Patients examined by surgeons, ultrasound and blood tests will give definite diagnosis. Appendicitis is a surgical emergency. Once the diagnosis is confirmed, the patient should receive emergency surgery immediately, avoiding the broken appendix causing infection throughout the abdomen, septic shock, death. Pancreatitis. Lower back pain can be a symptom of pancreatitis, inflammation of the pancreas. The pancreas is a small gland, located over the spine, helping to digest and regulate blood sugar. When pancreatic digestive enzymes cause an immediate reaction in the pancreas, pancreatitis occurs. Pancreatitis can be acute, short-term, or chronic, long-term, and cause upper abdominal pain, spreading to the lower back, accompanied by fever, nausea, and vomiting. This is one of the complicated gastrointestinal pathologies. Severe prognosis for patients with acute pancreatitis, hard treatment in cases of chronic pancreatitis. Abdominal ultrasound, pancreatic enzyme screening and abdominal computed tomography help diagnose and predict the disease.